Hey everybody, I am Marshall with Chicago EMT Training, and
I'm Diego with Chicago EMT Training.
we will be doing a cardiac scenario for you guys. Um, I will be the proctor and patient, and Diego will be the EMT. Um, so let's get started.
Let's go for it.
All right. You are dispatched for a patient that was experiencing chest pain. They were swimming.
All right. So as I approach the scene, I'm going to make sure my scene is safe. I'm wearing my proper PPE. Is this my only patient?
This is.
All right. Sounds good. And then just in case, I'm going to consider ALS. So if they're available, I'm going to have them come over. In addition, I'm going to state that I think my nature of illness is going to be cardiac. So I go up to the patient. I'm just going to introduce myself. Hi, my name is Diego. I'm an EMT for Chicago EMT Training. What seems to be the problem today?
Hi, I was swimming earlier when I started experiencing some chest pain, and I feel a little bit out of breath right now.
Got it. So
Yeah.
I'm just going to state that my patient's chief complaint is chest pain with a little bit of shortness of breath. I'm then just going to ask the patient, could you go ahead and tell me your age?
Yeah, I'm 56 years old.
All right. And then can you tell me your sex assigned at birth?
I'm a male.
Got it. So I'm going to go ahead and state that my patient is a 56-year-old male that is experiencing a medical emergency. I'm then going to ask the patient, I'm going to ask you some questions that may be a little bit silly, but can you go ahead and tell me your name?
Yeah, my name is Marshall.
All right, Marshall. Can you go ahead and tell me what day it is today?
Today is Thursday.
Got it. And can you tell me who the current president is?
Yeah, Joe Biden.
All right. And then can you just tell me again why we're here? Or
Yeah,
where we are?
yeah, we're just in my pool in my backyard.
Got it. So our patient is ANO times 4. In addition, I'm going to ask our patient, did you take a fall today?
No.
All right, so we don't need to consider C-spine stabilization. And then I'm going to go ahead and ask my proctor, does my patient look sick? Does it look like they're holding their chest or anything like that?
Yeah, the patient looks a little sick.
All right, so I'm going to go ahead and say the patient looks sick. I'm then going to move into airway. So because the patient is talking to me, I'm going to assume that there's no sounds or obstruction in the airway. Is the airway patent?
Yeah, it is.
All right, solid. And then I'm going to move into breathing. So for breathing, does my patient have adequate tidal volume?
They do.
All right.
Yeah.
Does my patient have a regular breathing pattern?
Pattern's regular.
How does the breathing rate?
It's a little rapid.
Got it. And then are they using any accessory muscle usage?
Yeah.
All right. Sounds good. I'm going to ask for SpO2.
SpO2 is going to be around 90%.
Got it. And then I'm going to go ahead and ask for lung sounds bilaterally.
They are clear bilaterally.
All right. So they're clear bilaterally. At this point, I'm going to say my patient is a little bit in respiratory distress. So what I'm then going to do is I'm going to administer 15 liters per minute of oxygen via nasal cannula. Or not nasal cannula, apologies, non-rebreather. And then should I go ahead and just show that? All right. Let me just go ahead and show that on this side. So I'm going to place my regulator onto my oxygen tank, and I'll face it towards you. So we're just going to loosen it. And then where the 2 prongs are, I'm just going to place it, make sure they're sitting, and then tighten it. All right. And then I'm going to use the key to turn it open. So it's currently open. And then I'll go ahead and grab the non-rebreather, and just plug that in right there. And then go ahead and turn it to 15 and just instruct and put this over my patient, like so. There you go.
That's the stuff.
It's the good stuff. So after administering our oxygen treatment, I'm going to go ahead and then continue onto circulation. So the third part of our ABCs, our primary assessment, is there any major bleeding on my patient?
There's no major bleeding.
All right. And then I'm going to look for our skin conditions. So color, temperature, and moisture.
Let's say skin is normal color, temperature is normal, and they're a little diaphoretic.
Got it. Okay.
Yeah.
And then from there, I'm going to go into our looking at the pulse. So I'm going to ask for 4 things. I'm going to ask for strength. I'm going to ask if it's a regular pulse. I'm going to ask the rate of it, and then if it's equal on both sides.
Okay. It's strong.
Mhm.
It's equal on both sides. The pattern is regular, but the rate is rapid.
Got it. Okay. I'm then going to ask for a capillary refill.
Less than 2 seconds.
Okay. And then at this point, I'm going to be determining whether or not our patient may or may not be in shock. Just based off skin conditions and our pulse, although it's rapid, they could potentially be in compensatory shock or cardiac shock. But it's really early on just because of our skin parameters, and our pulse is still relatively strong. So if I were to do shock treatment would include laying them supine if they're comfortable with that, keeping them on 15 liters of oxygen via non-rebreather, and keeping the patient warm. At this point, I'm also going to say whether or not we're going to transport. So in this case, I would just transport just because it is a cardio issue going on. From this point, I think what I'm going to do is go ahead and go into our history. And this will be on the ambulance. So we're going to do OPQRST first. So was this chest pain pretty sudden, or did it develop gradually?
I started feeling it develop pretty gradually while I was swimming.
Got it. And then is there anything that makes it feel better or worse?
I feel better when I'm resting, when I'm not exerting myself.
Got it. Could you describe the chest pain to me in your own words?
It feels like there's a lot of pressure.
Got it.
In my chest.
Sounds good. And then does this pain or pressure radiate anywhere else?
Yeah, it does. It goes up my neck, and it's also going down my arm, my left arm.
All right. And then could you rate this pain or pressure on a scale of 1 to 10?
I'd say it's like a 6.
Got it. Yeah. And then how long did this pain, how long ago did it start?
Like 15 minutes or so.
Got it.
Yeah.
All right. And so at this point, I'm going to then move into my sample. So any associated signs or symptoms. So do you have any weakness?
No weakness.
All right. Do you have any dizziness?
A little bit.
All right. Any palpitations?
No.
Okay. And then you did say you were short of breath, correct?
Yes.
All right. After that, I'm going to go into ample. So do you have any allergies?
Not that I know of.
All right. No known allergies. Are you currently on any medication?
Yeah, I take some medication for my blood pressure.
Uh-huh.
Yeah. I have high blood pressure.
Got it.
Yeah.
And then are you on any aspirin or nitroglycerin?
Yeah, I take a daily aspirin.
Got
It's
it.
like 81 milligrams or something.
Mm-hmm.
And I do have a nitro prescription as well.
Got it. Okay.
Yeah.
So we're just going to note that down. And do you have any past pertinent medical history?
Yeah, I have a high blood pressure.
Got it.
And I also had a heart attack like 6 years ago.
All right. Things to note. Could you just tell me when you last ate, your last oral intake?
I had some breakfast a few hours ago.
Got it. And then what were the events leading up to it? Were you just swimming or?
Yeah, I was just swimming, and I just started feeling all these symptoms. So I stepped out and I called 911.
Got it. Sounds good. So just keeping the medications in the back of my head before we go ahead and administer any of them. Right now I'm going to go into our focus assessment. So just questions to consider. So do you have any signs or symptoms of a respiratory infection?
No, I don't think so.
And then have you had a cough? And if so, is there anything productive, or what is the cough? Or
there's no cough. I haven't been coughing.
All right. Sounds good. And then in addition, does it hurt to like breathe or be in a certain position?
No, just when I like move around,
Got
it
it.
hurts more.
Okay.
Yeah.
And then, so we're going to ask our questions now associated with our focus assessment. So we're doing a cardiology focus assessment. So does my patient have any JVD?
No.
Do they have pursed lip breathing?
No.
Do they have peripheral edema?
No.
All right. Can I get a secondary skin conditions after oxygen?
Yeah, let's say they're normal color,
Mm-hmm.
normal temperature, and they're less diaphoretic now.
All right.
Yeah.
Sounds good. And then is there any pink frothy sputum that I see?
No.
All right. So after that, I'm going to go ahead and ask for a second set of lung sounds.
Okay, they're still clear bilaterally.
All right, sounds good. From this point on, I'm going to go ahead and just jump right into vitals. So can I get a BP?
BP is going to be 164
Okay.
over 96.
All right, 164 over 96. Can I have a heart rate?
Heart rate is going to be 102.
All right. Can I get a respiratory rate?
20.
20.
Yeah.
I'm going to go into diagnostics now. Can I get a blood glucose?
74.
All right. And then can I get a secondary SpO2?
SpO2 has improved. Now it's at 96%.
All right. I'm going to just go ahead and make a field impression that I believe the patient is currently experiencing some stable angina, just meaning that when at rest, has the chest pain gotten a little bit better now? Like slightly, potentially?
Yeah.
A little bit, but still present?
It's still present.
Yeah.
Did you want to do anything for the chest pain?
Yeah, so after I make that field impression, I'm just going to go ahead and, after I say that it's stable angina, I'm going to go ahead and administer some medications. So they did say, did you take aspirin today?
Yeah, I just took one.
Okay, so in order to reach that 324 milligrams, I'm going to go ahead and administer 3 tablets of that. And then did you have your nitroglycerin prescription on you?
No.
Okay. We're just going to follow a protocol that I have nitroglycerin with me. But since you do take it, I'm going to go ahead and help you administer that. First, I would just confirm everything in the prescription, all that stuff. But for the aspirin, I would help you, assist you with that and have you chew it. Nitroglycerin, I would do either a spray or sublingually, and I would just administer 1 tablet if it's sublingual at 4 milligrams.
Okay.
And so,
what would your contraindications be for those medications?
yes. So I would go ahead and make sure to ask before I gave nitroglycerin if the patient was on any ED medications. And
no ED medications.
Not on it. And then I would also, just because we already checked the blood pressure and it was 164 over 92 or something like that, it's well above our greater than systolic 90. So we can go ahead and administer nitroglycerin. And then for aspirin, since there was no past recent surgeries, nothing to consider there, no major bleeding, and they're not allergic to it, I can go ahead and administer that. After a medication, I would ask the patient, how are you feeling?
I'm feeling a lot better. Thank you so much.
Good. And then from there, I would just go into our reassessment. So just because our patient has gotten a little bit more stable, I would reassess every 15 minutes. I would reassess the primary, reassess our vitals, and then I would go ahead and check interventions and then reassess the chief complaint, which we just did with our patient. After that, I would just give a radio report.
Okay, let's hear it.
So I would just call Northwestern, like, hi, Northwestern, this is Chicago EMT Training Ambulance 1, calling in with a 58-year-old male complaining of chest pain and shortness of breath. Everything was normal. It's a slightly rapid pulse. SpO2 is at 90, so put the patient on a non-rebreather at 15 liters per minute. For the chest pain, we cleared everything. He took aspirin today, but only 1, so I administered 3 tablets, making a total of 324 milligrams. I assisted in giving nitroglycerin because patient was prescribed, as well as there was no contraindications found to help relieve the chest pain. And then the blood pressure was high enough to administer that or the vitals were 164 over 92, heart rate of 104, ventilatory rate of 20, blood glucose 74, and then SpO2 improved to 96. We are 15 minutes out. Do you have any standing orders?
Nope. We will see you guys soon. Thank you.
All right.
Okay.
There we go.
Thank you guys for watching. We hope you found this video helpful.
Was there anything you saw with it or no?
No, I think Diego did pretty good. I would just mention the medications a little bit earlier, but otherwise, you got it spot on.
Mm-hmm.
Yeah.
Definitely mentioned the the ED medications as well.
Yeah.
I think I just assumed that when I asked for the medications, I was like, oh, okay, like they're not on ED medications, but yeah.
Okay.
Awesome.
Good.